Hi, I'm Candace. I am doing the head-to-toe assessment video for Nightingale College. This is Ashley. She is my volunteer for the video. Ashley, do you consent to being on camera as well as having the head-to-toe assessment done on you?
Yes, I consent to having the head-to-toe assessment being done on me on camera.
Okay, perfect. So we'll start. I'm going to knock on the door and introduce myself. Hi, I'm Candace. I'm your nurse today. I'm here to do a head-to-toe assessment on you. Ashley, can you confirm your name and date of birth?
Ashley Boyden, 6/21/1984.
Okay. I'm going to do hand hygiene and grab my gloves. Overall, patient is resting in bed. She looks comfortable. Are you having any pain or discomfort?
No.
Okay. Is it okay if I check your vitals?
Yes.
Okay. So I'm going to check her vitals. Her heart rate is 65. Blood pressure is 120/80. Her respirations are 18. Pulse ox is 99% oxygen, and she's not having any pain or discomfort. From there, I will move on to start the assessment.
Okay.
I'm going to start at your head, and what I will be doing is I will be looking for symmetry, shape, and any possible lesions, masses, or anything like that. Everything looks great. No lesions, no thinning hair. I will then move on to, can you remove your glasses? So
Yeah.
that way, okay. We'll check your eyes. So I'm going to check sclera and conjunctiva. Everything looks within normal limits. No yellowness, discoloration. I'm going to use light to assess your pupils for how they react to light and accommodate to that. They're Perla. From there, I'm going to check your sinuses. Any pain or discomfort when I push on that?
No.
Okay. Throughout this assessment, if you are having any pain or discomfort, please just let me know and we'll take care of that then.
Okay.
So then after I've done that, checked your eyes, I'm going to then move on to your ears. I will check any open areas or redness. There are none. Check inside your ears. Everything looks great. Everything's intact. No excessive drainage or buildup. From your ears, I'm then going to check your nose. I'm going to check for symmetry and alignment. Everything looks great. I'm going to check inside of your nose as well and check for possible deviated septum, any open areas in the patency of your nares. No breakdown. Everything's within normal limits. From your nose, I will then move on to your mouth. And when I'm looking and checking inside of your mouth, I'm assessing your lips, your teeth, your gums, and your tongue. If you can open your mouth, please. And then stick your tongue out and say, ah.
Ah.
Okay. Mouth is pink, moist, and intact. No open areas. Tongue does move. Uvula does shift midline. No gag reflexes or anything like that. From your mouth, I am then going to assess your neck and check for any swelling or anything like that. And then trachea is midline. No swelling in your lymph nodes. Can you turn your head left to right? Up and down. Perfect. And then I'm going to gently press on your shoulders. Can you shrug your shoulders up? Okay, perfect. And then I'm just going to keep moving this out of the way because it's in the way. So then I will move on from your head. I'm going to then listen to your lungs. At this point, I would also do the 99 test and any cough or congestion?
No.
Okay. The anterior first. Oh wait, it's a little closer. Okay, and then I'm listening to the posterior. Okay, and I'm listening for any wheezing, crackles, or anything out of the ordinary, like bronchi or stridor. I think I said that right. Said that wrong. Right. Okay. Breathing is even and unlabored. Symmetry in chest. No difficulty breathing. Lungs are clear. From the lungs and respiratory, I am then going to move on to your heart. For your heart, I am going to listen to your. Okay, so I'm going to start on the right side, and then go. And then down further. So it would be 5 different spots: the aortic, pulmonary, herbs, tricuspid, and then mitral. When I listen to your apical, I'm going to listen for 1 full minute. And then going to check your pulses and check your temporal pulses and your carotid pulses. I'm also going to check your radial pulses and check your grip strength. If you could push up on my hands and then push down. Okay. I'm going to assess your nails, and for your nails, I'm looking for. Oh, never mind. Oh my God. Anyway, for your nails, I thought the camera would turn off. For your nails, I'm going to assess for shape, any discoloration, your cap refill, which is less than 2, the area around your nails for any like swelling and to make sure they're intact. I will also check femoral pulses, the behind the legs, the dorsal tibial pulses, as well as the pedal pulses on your feet right here. Okay, wait. If they are a little warm. Okay, so then from the pulses, then going to assess your abdomen. So after your pedal pulses, I'm also checking your toenails as well to make sure that they don't have any abnormalities with the color, the shape, and the oh my gosh, my brain is going flat. Your cap refill. Okay, so now I will assess your abdomen. So if you could lay back, and then I'm going to lift your shirt so I can inspect, then auscultate. I didn't auscultate your vowel sounds. I'm going to listen to each quadrant for up to 5 minutes, and then hear to make sure that I hear vowel sounds. Okay, vowel sounds are active. When was your last bowel movement?
This morning.
This morning, okay. And after I've listened, going to and then palpate. Any pain or discomfort when I press on your abdomen?
No.
Okay. And then from there, I will, so abdomen, and then we move on to check your legs, see if there's any swelling or discoloration, and I will move your leg up and then, or your pant leg up, and then check for swelling, and then make sure that there's no swelling, no edema. And then I want to also check for reflexes. If use the the reflex tester and check for no signs of DVT. And after my assessment, I'm going to remove my gloves and perform hand hygiene. I'm going to provide any education that is necessary for that. Going to provide any education that is necessary pertaining to her assessment and why she is at the hospital for possible procedure or anything coming up for her. Thank her for her time, and that concludes the assessment.